Hello, everyone. Welcome to yet another interesting, informative episode of the Anti-Pharmacist Podcast. Can you smell something in the air? Yay, that's Christmas. Christmas is in the air. Once we enter December 1 like this, you know it. You know the atmosphere just changed. You know that yes, the year is coming to an end. And thank God for bringing us this far, right? So far, we've had 19 episodes on this podcast. And that's great, guys. I'm so happy. I'm so proud of this podcast and how well it has done so far. We still have a few more to come before we round up for the year. Once again, I will not get tired of saying it. Thank you so much for your support up to this point. And please keep it coming. You know, right? We need your support to keep going. Yes. So, on to today's topic. Last week, I talked about drug interactions with a focus on the drug interactions. So today, I want to continue that trend by talking about drug-food interactions. By now, if you listen to the last episode, you know what interactions mean. But if you haven't listened to it, let me just recap a bit. It's just the relationship. You know, when we say we interact now, those communication, if we could say it that way, between drugs and other substances. It could be drugs, it could be food, it could even be a disease condition, that is a state. It could be pregnancy, all right? Those will be coming up later, but today we're focusing on drug-food interactions. And this simply means the effect your food has on the medication you are taking, with it or shortly after it. You understand? You might take medication now and shortly after you eat your food, or you might eat the food and take the medication at the same time. Most times there are interactions, and these interactions can be either positive or negative. Some of these interactions are actually harnessed to the advantage of the patient. That's why some drugs will tell you to take with food. Others will tell you take 30 minutes before food, after food. Why we are saying this is because of the drug-food interactions. Sometimes, like I said, it can be positive. Other times, it can be negative. So what we try to do as healthcare professionals, as pharmacists and drug experts, is to maximize the positive interactions between your drug and your food, and to minimize as much as possible the negative interactions, or to even prevent them from happening at all. So sometimes you might wonder why you take medications and you eat certain foods and you start feeling funny. Some people, even have nausea and they vomit. Others, have diarrhea, constipation, and all of that. This is because of drug-food interactions most times. And you know that foods are also chemicals on their own. They contain different chemical substances, although natural. But those chemicals also will definitely interact with the chemicals in your drugs, even if those ones are synthetic. And mind you, not all drugs are synthetic. Some are made from natural products too. Okay, so I'll be talking about common drug-food interactions and the reason behind them, the drug and the food and the kind of interactions that actually happen between them. I know last week while talking about drug interactions, I mentioned particularly alcohol, that it is not to be taken with most, if not all, of your medications because of the interaction. Alcohol can be classified both as drug and food. Some take it, just for fun because of the kind of effects it has on them, just for relaxation. But alcohol can be classified as drug as well because it is a suppressant. All right, it suppresses the central nervous system. So some people take it when they're anxious, they want to calm down, and all of that. So I'll be starting from there. Taking medications with alcohol, I tried to explain to a point last week, but I'm going to elaborate today. Taking medications with alcohol is not advisable because alcohol is metabolized by the liver and excreted by the kidney, just like your medications as well. There could be interactions in the liver in which I said it that alcohol is an enzyme inhibitor. It will not let your drug be cleared out of your system on time because, well, the enzyme in the liver that is supposed to metabolize your drug is busy metabolizing the alcohol. So your drug stays in the system longer and the toxic effects are amplified because they are still in your system anyway. And every drug, has side effects, right? A very good example of a medication that should not go with alcohol is paracetamol, acetaminophen. As simple as that is, some might even in ignorance use alcohol to take medications. You don't know that you are hurting yourself. Taking alcohol with paracetamol can lead to liver toxicity. It could even lead to lung damage in which you are not able to breathe, and that could lead to respiratory failure. It's as bad as that. So you should not take alcohol with any medication at all. Moving from that, now let's go to food proper. There are some foods that you should not take with medications, and fruits are examples of food, right? Because they can be classified into some classes of food, all right? They have vitamins, some are vegetables. So fruits are foods. Now, have you ever wondered, maybe you're somebody who takes some blood pressure medications and your pharmacist or your doctor advises you to not take bananas with them? It is because banana is very high in potassium, and most of these blood pressure medications also cause hyperkalemia, that is potassium retention in the body. Do you get? While they cause hyponatremia, that is reduced level of sodium in the body. So you eating banana will increase the level of potassium, which is already high because of that medication you're taking. And this could lead to arrhythmias because excess of potassium in the body causes cardiac arrhythmias, and that could just lead to death. Your heart could just stop beating. Do you understand? There is also the case of oranges with antimalarials. Like I said last week, vitamin C interferes with artemisinin combination therapies. And oranges, grapes, limes, citrus fruits are so rich in vitamin C. So when we tell you do not take fruit juice, do not take oranges while taking these medications, I guess you know the reason why now. Then let's go to sugar. Sugar, yes, our normal sugar. When you're treating diabetes with drugs like metformin, with even insulin injection, you should not be taking sugar because it's like you're canceling the effect of these medications. These medications are supposed to help your body, your muscles, to utilize more of this glucose, these carbohydrates in your body. But then you're supplying more of this carbohydrate when your drug is trying to help your body get rid of them. At the end of the day, it's like you're canceling the effect of the drug. I talked about antagonism last time, right? Yes, your foods too can antagonize your medication, and that's an example I just cited. Another issue is using Coke to take medications. Do you know that Coke contains caffeine? Do you know that? And then you say, I want to take this pain reliever. Maybe it's like diclofenac or ibuprofen. Then you're using Coke. Do you know that you're complicating matters for yourself? Coke already has sugar. That's another point which I just stated. But the caffeine inside Coke also predisposes you. It's a stimulant. And what stimulates your bowel movement increases the acidity of your stomach. Now, NSAIDs cause hyperacidity due to the inhibition of prostaglandin, which could lead to bleeding, peptic ulcer. Now, you are using caffeine to take your NSAID, your pain relief medication. Before you know it, your ulcer will be complicated. And that is why, for ulcer patients, did you notice, or have you ever noticed that whenever you drink Coke, you just become uncomfortable? Don't forget that Coke also has gas. It's a carbonated drink. And that gas is your enemy as an ulcer patient. So we are not talking about drug disease or food disease interaction right now. So let's focus on that caffeine inside your Coke and your NSAID, your pain relief medication that you're taking. They do not go together. That is one example of food-drug interaction. As I think about it now, I think of all the 6 classes of food with water. Water is the only one that doesn't interact with your medications. That is why it is the best fluid to take your medications with. Not juice, not milk, not soft drinks, just water. Because like they say, water, food can be of different classes. So when you're taking your medication and they say take with food can be carbohydrates, protein, right? Fat-rich food, vitamins, minerals, or even fibers. Those are the classes of food. So when they say take your medication with food, you can go further to ask that what kind of food. And I'm sure your healthcare provider will be able to understand that, wow, this person knows what they are doing. This person is informed, and they will tell you the right kind of food to take with your medication. Or you could just ask, do I have to take this with or without food? Then they will be able to tell you what you're supposed to do. All right? So there's a class of medications called monoamine oxidase inhibitors, and they are used to treat depression. You should not take these medications with foods containing an amino acid called tyramine. Tyramine is involved in the regulation of blood pressure in the body, and it is found in foods like cheese, even bananas, some fermented food, smoked or processed meat, sauces, soybeans, dried or overripe fruits, your dates, your overripe bananas, your raisins, yeast extracts, even alcoholic beverages like beer, red wine, and a host of others. You should not take this while on this antidepressant. Why? Because the monoamine oxidase inhibitors inhibit an enzyme called monoamine oxidase, which acts to also break down tyramine. Remember, I said it's an amino acid. And if this enzyme is inhibited by these medications, then there's high level of tyramine in the body, and this could lead to hypertensive emergencies. It could lead to very high blood pressure that could eventually lead to death. Then for those that take aspirin, the low dose aspirin, those that take blood pressure medications like Vasopressin 75 milligrams, for example, or some aspirin cardio that is 100 milligrams, you should reduce the level of green leafy vegetables that you take. I know that we said that you should take vegetables, but please, knowing when to take these vegetables is key. Green leafy vegetables contain vitamin K. In fact, they are high in vitamin K. And what vitamin K does is that it decreases how well aspirin thins the blood. So consuming the same amount of green leafy vegetables each day will decrease this interaction. You should be careful not to take your medications at the same time you're eating your vegetables, because vitamin K is an antagonist to aspirin, and vitamin K is in these green leafy vegetables. Same goes for grapefruit juice. It alters the way the body absorbs statins, that is cholesterol lowering drugs, the likes of Lipitor, and it can cause the drugs to be absorbed in higher than normal amounts, which results in greater risk of their side effects. Also, calcium channel blockers, the likes of amlodipine, nifedipine, which are used for high blood pressure, they are also affected by grapefruit, because this grapefruit prevents their metabolism, causing high levels of these medications as well, increasing the risk of side effects. Dairy products like milk, yogurt, cheese, they decrease the absorption of antibiotics, so you should not even take antibiotics and milk together. Leave like an hour or two in between this food and the medications. Then there are some medications that you should not take at the same time as rich protein foods like eggs, like meat, like fish. Medications like warfarin, like propranolol, because the serum level of these medications are increased by the rich protein foods, and that could cause increased side effects of this medication as well. Then there are some medications that we advise you to take with high fat meals, because these help to increase the bioavailability of these medications. Example of such medications are antifungals like ketoconazole. Their absorption is increased in the presence of foods. That's why you should take them while eating. And antihelminthics as well, like your warm medicines. Then for people taking antidiabetics like glimepiride, you should take it with food, because it causes absolute bioavailability. That is, there is 100% absorption by your body, and that is an advantage for you. So with these examples, you see why there are some medications which say take 30 minutes before food, take with food, take after food. Do not take certain foods with it. There are reasons for it, all right? And like I said last week, if you're getting medications, please ask your pharmacist or your doctors, which food should I take with this? Which should I not take with this? In case they forget to tell you, all right? It is to your benefit. All these interactions are better known so that your medications can work at their maximum, so that you can get your optimal effect from your medications. And that is all I have for you on drug-food interaction. Next week, I'll be coming with drug-disease interaction. So keep your fingers crossed, because I know that it will be as informative, as educative as today's episode. Do not forget to share this episode with as many people as you know take most of these medications, especially those people that take the antihypertensives, anti-diabetics, cholesterol lowering medications, and those that even take pain relievers. I mentioned them, right? So please share, follow us both on the streaming platforms and on social media. Suggest your topics to us via our email at antiphemicispodcast@gmail.com. We'll find out what you want to hear about and bring it to you. Till next time, stay healthy and God bless you.